Hey everyone, this week I wanted to talk about an interesting topic that happened to come up. Um, we recently had a family that was interested in doing some organ and tissue donation. The first thing I wanted to cover was how this relates to a social worker's role in hospice care, and then I was going to go into the specifics of that particular case because there's some ethical considerations that came into play, and I'm kind of looking for a little bit of feedback on that and what you all think. So, a lot of families say that they're interested in organ and tissue donation, but they don't go through the whole process. This process offers the patient and their family the opportunity to leave behind a legacy, which kind of brings some relief to an otherwise painful experience for them. There's actually very little research regarding the role that palliative care plays in the process. So the role of the provider is to assist the family in understanding the process and to collaborate with the state organ procurement facility. Um, there's even less information that exists on organ procurement for those who choose to spend their final moments at home. Um, for the organs to be viable, I'm sure many of you already know this, the patient needs to be placed on life support. And this, in the hospice setting, is considered to be a sustaining measure, which is not typically covered by hospice. So this leaves the hospice facility in a kind of interesting place because while you want to honor the wishes of the family, it's kind of hard to explain to them at times when it's not feasible, when they're so dead set on being able to do this. And this was the case of the family that we just encountered. They The patient had gone through the process both in 1999 and 2002 to put himself on this registry. So both New York and Vermont have registries that they will send someone out to do like a physical examination, and they go through a really long interview process. They have to make sure that your physical condition is appropriate, which typically means that you're under a certain weight, you don't have certain health problems, which in the hospice setting, there's a lot of different factors that come into play because, say, the patient has renal failure. Well, that right there takes them off the list for a lot of different donations. And in the case of this patient, that was kind of what happened. And his primary care physician stated that all of his organs were able to be donated despite him having some pretty serious health problems with his heart and his kidneys, which made a lot of his organs not viable. And he is also choosing to live out his final days in his daughter's home. So if he happens to pass at her home, his organs are not viable. It is going to take far too long for the procurement facility to come and get the body and get it to their facility to be able to harvest those parts that he would like to donate. So, in our process of trying to track down all this information, we found out that he did not go through the full process and he was not eligible to donate a pretty good majority of his organs. So having to break that information to the family was pretty tough, and they still insisted that they would like to be able to donate something, some part of him. So we went through all the different state registries to find something that could be donated. And it was really unfortunate because right now, New York State doesn't want to accept anything. They will accept parts from a young, healthy donor who passed away through a car accident or something like that. But patients in a hospice setting, they're not interested. So the role that I'm struggling with is this family was so dead set on being able to do this for their loved one, and these are his wishes. So, in the role of a social worker, how would you approach this situation where you're acting in an ethical way? You want to honor the wishes of the family, but you know that it's not feasible. Do you kind of try to sway their decision in a different way? Or do you just kind of keep going through the process with them and hope that, there's a different outcome that's possible? I look forward to hearing your feedback. Thank you.